Go outside. On and on and on and on. I'm a winner. I'm a winner. Hey, watch out now. I'm a right now. You winning. Now me forget that trophy to what me living right now. Cause me right now. Yeah. And I'm chilling right now. Cause oh, we winning right now. Cause winning right now. I'm winning. I'm winning. I'm winning. Watch on up. Hey, I'm a walking W. Learn from the else. Turn them in a medal in a trophy and bells. Every day you see me with the break like we practice shell. And everything up the expel. It's all about progress, cause we have to excel. I want in life, success we dress well. Another not going for the ring, the expel. To send my ears as I can't well, cause of it. Sick of it. Yeah, so sick, but that's the whole gist of it. I yet in the beauty when me it, cause I'm winning. I'm winning. Oh, we're winning right now, you I say we're winning right now. Me forget that trophy to what me living. Cause right now, and I'm chilling right now. Oh, we're winning right now. Our Thanksgiving right now, yeah. I say we're winning right now. We be at the in champ and at the cloud with the silver line we raining from. Cause if you see some of the places where we hailing from, it's just the type of place we should be failing from. But now we're winning. Yes, every part every inning. Multiple tracks and then a films if I'm swimming. You know that there's no giving in no matter the circumstances we living in. You hear me? I'm winning. I'm winning. I'm winning.
Greetings to everybody and welcome to the final night of Chancellor Hall's Youth Empowerment Conference. We're operating with the theme Building a Better Men, or rather building a better world for our men. So tonight we are in our final edition and we want to apologize first and foremost for our wee bit of a late start, but not to worry. The action-packed program will certainly make up for that. Now, today's edition is special not only because it's the final episode, but it also falls on International Men's Day. Now, without further ado, we're going to move to our national anthem as we show some reverence and some respect.
The national anthem represents the beauty, pride, and resilience of Jamaica and our people. My name bold. It's honor to Jamaica, our country.
Good night once again. So, for those who are just joining us, you are at Chancellor Hall's Youth Empowerment Conference under the theme Building and Shaping Men of Tomorrow. We are in our final installment. We'd like to extend greetings first and foremost to all the Chancellorates in the house, whether past or present. We'd also like to extend a warm welcome to those from the extended UWI community who have joined us for this momentous occasion in the Cubs and in the Chancellor Hallscape. Now, as we are proceeding with our program, we want to invite the presence of the Lord into the proceedings. And as such, we're going to call on Mr. Tavan Bulgin, our choir vice president, to offer up some words of prayer.
All right, so good night, one and all, and a special commendation to all the men that are here. Happy International Men's Day. So let's close our eyes for prayer. So, most righteous, eternal God and our Father, I want to thank you again for another night. We are finally at the last night of our impactful and very eventful Youth Empowerment Forum. I want to thank you, God, for having brought us this far. These forums have been excellent and wonderful and very, very, very full of substance, dear Lord. And I want to thank you. And we pray that you remember the presenter tonight. Tonight will be nothing short of greatness. I remember each and every one of us here tonight again, dear Lord. And at the end of the night, we can say it was very much good to be here. Bless us one and all. Remember Chancellor Hall as well. And remember each and every one of us that is watching this. Bless your name. In Jesus' name I pray. Amen.
All right, go ahead. All right, thank you very much, Mr. Bulgin, for that very potent prayer. Now, as we proceed with our program, I just want to big up especially the members of the Hall Committee and those who are in studio with us, helping to make this conference a big success. As was stated earlier, today's edition is very special as it falls on International Men's Day. And the theme that we're working with is better health for men and boys. Now, this theme is focusing on improving and enhancing the overall well-being and health of our men. And we do hope that the men in the house would have seen this theme being exemplified throughout today. And we hope that the females, of course, would have made the day special for the men, checking in on them, ensuring that they are prioritizing their health, ensuring that they know that they are cared for, they are loved, and that they are appreciated, so that they can go out and conquer and really exemplify what it means to be a man. Now, I'm not sure if I stated this earlier, but this Youth Empowerment Conference is a Cubs initiative. Cubs being Chancellor Uplifting Brothers Society. Now, we do know that this is a philanthropic arm of the Chancellor Committee. Experiencing some backup here. Do bear with us. All right, we're back live. As I was saying, Chancellor Cubs has been spearheading this conference, and Cubs stand for Chancellor Uplifting Brothers Society. And as such, we're going to have some greetings from the Cubs president, Mr. Bruce McDonald, as he comes on screen. All right, we're hearing that Bruce isn't quite here as yet, so we're going to just give a little recap of what happened throughout this conference. It has been a very jam-packed and enthralling series. We kicked off our conference with Dr. Christopher Tufton speaking on the first night. He was then followed by Mr. O'Shane Grant, a past guild president. Last night we had Mr. Courtney Campbell, CEO of the Victoria Mutual Group. And all of those presentations, they were dynamic, they were engaging, and they left the mans with plenty of gems to conquer the world, to go out and to say, all right, I've gotten some advice from all of these influential persons. I know that I can achieve success. Now, we do hope that Mr. Bruce, he isn't able to join us. Oh, Bruce is here. All right, we're experiencing a bit of phonetics in our presentation tonight, but Bruce is going to join us right now to bring some greetings.
Good night, everyone. My name is Bruce McDonald, President of the Chancellor Hall Uplifting Brothers Society, And I want to send a very heartfelt welcome to all those who have been with us for the entire week as we tackle as we take on the task of empowering and uplifting our youth. And as today we recognize International Men's Day, it is a very key day for us as men as we look on the issues that men are facing in today's society and try to yeah, I'm sorry about that. Yes, as we look on the issue that men are facing in today's society and basically try to tackle them head on. And it has been a great week, I must say. And as Mr. Stephen Nelson summarized before, what the happenings of the week. And I really look forward to tonight, and I hope everyone here can really enjoy themselves. Thank you. Have a great night, everyone.
I mean, value yourself, think highly of yourself. No, you're very important. Hashtag, I'm a big deal. VIP, VIP, VIP. Ask anybody, boy. I'm a big deal. Me and my friend, I'm a big deal. Yeah, we're kinda important. For real. Oh yeah, I'm a big deal. And my friends are some big deals. Very, very, very important. For real. This has nothing to do with money or fame or vanity. This one is all about self-worth. So big up your chest and stand proud and don't matter about nobody. No man no more than no man on this earth. So whether you walk or you a drive car, I tell if you're white or black lighter, me feel good in yourself, you're a star. Push up on no one and tell all the haters I'm a big deal. You're my friend, I'm a big deal. I'm if you tell you, yeah, we're kinda important. Okay, for real. Oh yeah, I'm a big deal. Believe me, my friends are some big deals. Okay, very, very, very important. For real. It's like you have the prime minister, and then you have way. That are the order in a few week country. Yes, that are the status of the hierarchy. Ask anybody about it. 4.0 and the great point average. And we never cheat or copy if you get it. You know you want your dreams and nobody can stop it.
All right, so after that, it's a commercial break. We can proceed with our program. As we said before, we have been blessed with a wealth of very good presenters throughout this series, and tonight will be no different. Our speaker for the night is a chancellor, of course. He hails from Block Excellence. I'm sure we can see some of the Block X mans showing some love in the comments. He's a practicing medical doctor, and while he was here within the university space, he showed some traits and some skills that have led persons to say that he is a very well-rounded individual. He showed prowess in leadership, in his academics, of course, and also he was a person who excelled in the sporting arena as well. We can see that where he represented the University of the West Indies in volleyball. Now, he was not short of accolades and awards, and we see where he was awarded Block X Man of the Year and Sportsman of the Year in 2015-16. There we see Clive Lindo showing some love. Clive Lindo, incidentally, a past Block X representative. Now, our presenter capped off a tremendous university experience by being the valedictorian of his graduating class in 2016. Ladies and gentlemen, please join me and help me make welcome our presenter, Dr. Marlon Reid.
Good night, everyone. And it's a privilege being here, and I must say it is fittingly appropriate and appropriately fitting to be given a presentation on Men's International Day. And I must say that I am very impressed with the forum thus far. Must say thanks to Narjay for inviting me to give this speech. I realized how the men are well put. Mr. Nelson, hats off. Bruce, blessings. I don't have, or let's say I won't go on camera because I have work today, but when Narjay told me that I was invited to give a talk on health, I decided that whether I was working or not, I would find the time to do so, as Chancellor lives on way beyond just the confines of the hall. So I am going to be speaking about health today. So man's and man's blessings. So I'm going to share my screen, and I wanted to confirm that you're actually seeing my screen. So can anybody see my screen? Mr. Nelson, can you confirm that you see my screen? Are you still hearing me?
We're hearing it, but we're not seeing the screen as it. Our tech team is working on adding it to the full screen. All right, so the guys in the studio are asking if you've pressed the share screen button, has it?
I did. Let me check that one moment. So I have clicked on it. Any confirmation that it's working now?
All right, we haven't received the share screen option as it. We're working something out at the moment.
This beat is like a fire, like a fire. She, oh no, I'll be upon the mountain, upon the mountain. When come for me, yeah, yeah. Cause I'm a survivor, survivor. I'm a survivor. Oh, cause I'm a survivor. Survivor, I'm a survivor. My enemies surround me, nothing make no fair. Cause them know which path to find me. I am like a flare,
Mama know them want to kill me. Tell me how them want to see me. I know them want to kill me. Who cares? 'Cause God is my provider. Every
All right, we're able to broadcast the presentation now, so it should be good to go.
All right, thank you very much. Sorry about that, months and months. So, as I said, today I'll be speaking about men's health. And as Nelson introduced me, I am a Black X man. So that X is the unknown variable, but there's more than such. Big up to all the blacks of Chancellor. Um, Thank you for the introduction, Mr. Nelson. So I'd like to start with definitions. So first definition is, what is health? Ideally, I'd like this to be interactive, but from my screen, I can't. While I'm sharing, I'm not able to see who is in the forum. But health, according to the World Health Organization, is a state of complete physical, mental, and social well being. So I want you to pay attention, and I want you to make note that it's not just the absence of disease or infirmity, but has to deal with the holistic approach to the individual. So physical, mental, social, and even spiritual well being. And who is a man? As you can see right here, we have the evolution of man. We say that we're coming from primates to now where we are standing tall, standing brave and tall as a chancellor man. But even though we have evolved through the years, there are still some traits that are, what can I say now, ingrown in men and will never leave us as men. So you have two different kinds of men out there. You have the regular men, and then you have this kind of man. This man is a chancellor man. So I really want you guys to make note of that and can make a distinction between you and other men out there, that you are a chancellor man. So given that we are men, and as I alluded prior, that there are certain traits that are ingrained in us, and this definitely affects our health-seeking behavior. There was a study done and in Nigeria, and it was an interview, and some of the factors that were listed as barriers to men seeking health include they not being aware of health issues which are peculiar to men. Separate from the female, our anatomy, meaning our body, what we have different from the female is the genitals, that include the testicles, penis, and also your prostate. We do have breasts, and believe it or not, men can have breast cancer, although this is very, very, very rare. Our perception of the nature of the illness, sometimes we might think it's not a big deal or it's not as serious. So we are less likely to seek health care at the time, and we are more likely to do what we call the watch and wait. The perception of knowing our own body, we know how our body should feel. We know when it feels off, and so because us having a perception of how our body is, that might delay us seeking health, right? This is a new phenomenon, and it's being increasing rapidly, which is the use of the internet. So many people more likely to go to the internet as their doctors and to self-diagnose. So this might affect their health-seeking behavior. This one I'd want you to pay particular attention to, which is our level of conformity to masculinity, what we believe in. because we are man. Men are supposed to be strong. We're supposed to be tough. Men don't run to the doctor like the women do. And because we portray ourselves as being that masculine, and it's probably a feminine trait to be running to the doctor all the time, that can affect our health seeking behavior. Also, men are more likely to seek medical care with persons they are comfortable with, they are more associated with. So a lot of my chancellor brothers, because I'm a medical professional, they more to seek advice from me. For some, I will entertain, and others I will direct towards the health system. You know, Also, men would want to seek other means of treatment, spirulina. There are a lot of alternative medicines. Some people will go to the cannabis and all other alternative forms of treatment. So health is broad, and we can speak about many different aspects of health, but a topical issue and what I think relates more to men who are in university is their sexual and reproductive health. This picture that you're seeing, I don't know if this has happened to anyone before, but as a man, we know that we take pride in our genital, and that our penis is our manlyhood and is our second heart, if you want to say. So, how many of us are even familiar with the structure of our second heart? I mean, it's not beating well, it pulsates when you have an erection. But how many are aware of the anatomy? So, as you can see from the picture, many people are aware of what the penis is. That is that's the pendulous portion, right? That is where give you your girth and your length, right? As you can see, running through the penis is the urethra. And this is basically a conduit for the passage of urine and also for the passage of semen, right? You can also see your testicle, what we colloquially refer to as the balls, right? And you have on top of it is an epididymis, right? And as you can see, right here is the prostate gland, and that is really for to help to produce some of the liquid nourishment for the sperm. So it's part of your semen. And as you can see, you have your seminal vesicle. This produces semen also, and semen is for nourishment of the sperm. But one thing that men are, I'd say even most Jamaican men, and I tell you an incident where I heard that someone actually shot their doctor because the doctor performed an examination of the prostate. And upon performing that examination, the man actually ejaculated. So he shot the doctor, I'm not sure why, but the doctor didn't die. And the reason being, as you can see where the prostate is located, and if you look to the right of the screen, you see where that's your colon, which is basically your intestines. And right here would be what we call the back passage or the anus. So in order to feel and to assess the prostate, the doctor has to place a finger inside of the rectum and to press on the prostate. That's how the doctor examines it. And it's called a digital rectal examination. I wouldn't advise this for youth of your age, but more likely when you're above 40 thereabout, you should think about screening for prostate cancer, as it is the number one cancer in Jamaica, and it actually shows that Black people are affected poorly by it. Right, and this is the vas deferens, and what it does, it carries sperm from the testicles all the way through to the prostate, going into the urethra and out through the penis. So this is just the anatomy, so you can be more familiar. So you can you can more express yourself to a doctor if you so do happen to want to visit. This particular topic sexual health is very important. Health is the wealth of the nation. And I find that, especially for university students, that their sexual health is paramount. For the chancellor men, we know that, you know, many people want to get the accolade of junior piper, senior piper, so they may have increased promiscuity, sometimes may not be protecting themselves as much. And sometimes they do feel that something is off with their private part, but them being shy and because they don't have that um, proper health seeking behavior, then they want to treat it with other remedies or not seek medical attention. So if, well, I'm a doctor and someone comes to my office and saying that, doc, having a discharge. So what they refer to as a discharge is just an abnormal fluid coming from the penis. You can have sperm there, but discharge usually are what we call pathological, meaning disease related. So you may have a yellow discharge. They might have burning when they urinate, and this usually occurs after unprotected sex. And yes, if the condom bursts, that's still considered unprotected sex. So some of the health problems that I might consider is one, do you have gonorrhea? This is usually caused by a bacteria, and because it's a bacteria, you typically start having symptoms of burning when you urinate and discharge within 3 days after exposure. You also have chlamydia, which can cause the same, but chlamydia sometimes goes unrecognized and you might just have burning. There's also what we call trichomoniasis, and this usually has a very foul smelling green discharge. Bacterial vaginosis is more for the females, and this is where it smells fishy, like literally fishy. And yeast, men can have yeast too. Yeast usually presents with as a white discharge in female. The male might have some fine rashes to the penis and also a white membrane covering the head of the penis. So if someone has genital discharge syndrome, then I am more likely to treat. Reason being because there are complications that can be associated with this. And one of it is that right where I show you where the urethra is, if you having an infection there, the infection can cause damage to this area. And how the body heals is by forming scar tissue or scab. And if you get a cut and you look at the scab, you see that it's kind of wrinkled up, so it narrows down. So imagine if this tube is supposed to narrow down, then you will have no passage of sperm nor urine. And guess what? The bladder right here will just enlarge, and can even burst. So that is just chaos right there. Also, is important when to treat your partner because she might be the one infecting you. And guess what? When you approach a lady, you don't know her sexual history. You don't know if she was over Taylor the other night, over Irving, or you can't do trust the ladies out there. So you have to do what you have to do and protect yourself. The seven commandments say always keep thy boots near at hand, not knowing when and where they will be an ambush. So also another common pathology or disease associated with the penis is genital sores. So some of the conditions that can cause these include syphilis. Syphilis is caused by a bacteria. And the thing with syphilis is that it starts off as an ulcer, and it's just a single ulcer, and it is not painful. That is very key to know, that it is not painful. This ulcer usually disappears and heals on its own. So you're a young man, you see an ulcer, you're too scared to go to the doctor to seek care. You let it heal on its own and you say, yes, I'm doing fine. But what happened is that approximately 3 months later, you'll start to find that you're having rashes to your hands and to your feet, and you start having some sores all over the body. That is what is called secondary syphilis. That means that it's now spreading to different parts of the body. And if you still want to be very, resistant and don't seek health care, it can even go to a tertiary level syphilis, where this can now affect your heart, it can affect your nervous system, and this can lead to very, very severe complications. So, one of the main reasons why I want to present to you guys all of these things is that if you do see it happen, that I'm imploring you to actually seek some medical care so that you can prevent complications. Yes, I would have liked you to prevent yourself from getting any of these illnesses, but if you do get one, you can prevent yourself from getting the complications of it, right? Herpes is another cause of genital sores, and this is usually multiple ulcers being present, and they're usually painful. And you know what Jamaicans call wax and canal, you might even have that. It's a virus, so how do you feel when you have the flu? You just feel sick. You don't feel to eat. You can have some of those symptoms. Herpes, unfortunately, there has been no cure for it. What this virus does is that it lives inside the nerves. And then, if, for example, you are stressed, you might have reactivation of that virus, and it travels along the nerve back to the site that was first seen. So if it's on the penis, it's there. Some people call the oral version of herpes night fever. It is still herpes. There's usually two viruses, one and two. Either one can cause genital or oral herpes. There's a disease known as chancroid. This one is not as common, but this is a very, very painful ulcer. And it's so painful that the organism or the bacteria, name of it is do cry. So what they say, you do cry when you have do cry, right? Granuloma inguinale is not common, and this is where there are a lot of sores and a lot of lymph nodes or wax and canal in the region. This is a big issue. It has always been a big issue since the early 1980s. I'd want you to know that HIV and AIDS are not interchangeably. You can have HIV and not have AIDS. AIDS is when you have HIV and you have a very, very, very severe course of the HIV until you start to developing certain diseases. So you have AIDS-like diseases, right? It is most common among heterosexuals, so it's not common as it's not the most common amongst homosexuals. However, homosexuals have a increased risk of catching it over a heterosexual, right? The risk increases with promiscuity. Again, junior piper, senior piper, just man and a whole chancellor man, right? And I want you to know that it is not a death sentence, right? There are no medications available that can essentially have an individual to live a near normal life. I say near normal because even though we're treating as patients, there are a lot of psychological impact and a lot of mental health issues associated with HIV and AIDS and even any of these sexually transmitted infections. So, how do you prevent yourself from this? Prevention is better than cure, and I'm a doctor who believes that. I'm not a doctor who believes in just medication, but prevention is better than cure. As I said, safe sex, use your condom all the while. Put commandment number 7 in your wallet, right where you keep your condom. Put it in your drawer that you keep your condom, in your back pocket, anywhere you keep your condom. You know, put commandment number 7 somewhere where you can see it, so you can protect yourself, right? Some other problems, not sexually related, but related to the genitals, right? There is something that is called torsion of your testicle. Torsion right here, where you see being annotated testicular blood supply. What happens is that the testicle twists on itself. So imagine if you twist the blood supply, there will be no blood flow into the testicle. And they said blood is life. And if no blood is flowing to your testicle, then the testicle might die. So if you find yourself having sudden severe pain to your testicle, I don't have to emphasize the importance of you having to seek medical attention. But if you're having that severe pain, especially if you start to have vomiting with this severe pain, gentlemen, go straight to the emergency department, because you can lose that testicle. And guess what? You lose one of your heart there, gentlemen, right? And there's even what we call this long word, epididymoarthritis. And basically what it is inflammation or an infection of this structure right here on the testicle. Usually, if you have a sexually transmitted infection, this can be a complication of it. Testicular cancer. It is most common in men who are in their 20s, right? And this usually present with you feel a lump in the testicle, right? I won't say that men frequently feel of themselves, but I know men touch themselves, right? And if you do feel a lump when you're examining yourself or whatever you're doing, you should be concerned, especially if it is not painful. And if you find that you're losing some weight, you're not eating as much, should be definitely concerned. So when regards to your testicle, men, don't have fear. I think you should go and get a visit and even to get a second opinion on what is happening. The penis. So, yes, the penis can be fractured. It doesn't have a bone, but if there is a tear, in the penis right here, right, anywhere along here, they call it fractured penis. This usually occurs when there is sexual intercourse, and this is usually when I guess they're doing some daggering, right? And the most famous position is if there is backshot, and if the penis misses and hits the female on her bony area, then you can have a fracture of the penis. What will happen right there? You lose your erection immediately, and men usually present directly to the hospital when this happens. They might be a bit, can I say now, reserved, and might give a different story that, oh, is a cricket ball hit them, because oftentimes they are caught in the act of infidelity. This is when this happens. You have a condition called phimosis, and this won't occur to men who are circumcised. This is more the uncircumcised men. This is when the foreskin cannot be pulled back. And if you cannot pull back your foreskin, then definitely you're going to have some hygienic issues, because you're not going to be able to clean that area. And once you're not able to clean that area, people call this muck or gunk, but this smegma can develop and it can get an infection. Paraphimosis is even worse. This is when the foreskin is pulled back, but it cannot go back over. If you're having this, gentlemen, you should try to put it back over as soon as possible. If you can't, then you go to a doctor. But what will happen is that it is like this: the skin is choking the head of the penis, and there will just be swelling. Urinary tract infection is not common in men, but if it does happen, then usually you would have to think that there is something else occurring, right? People usually have burning when they're urinating. The urine smells bad. It looks a bit cloudy. You're urinating a lot. You might have some pain to the lower belly, right? Impotence, this is always a topical thing. Men always say, Doc, you don't have anything for the boy, and so forth. This is what can I say now? A thought-provoking issue is always going to be topical. It is our penis is our livelihood, and if it's not functioning well, then we are not going to function well. So it is important that you keep yourself healthy, not just physically, but also mentally. And I want to touch briefly on mental health, although I think it's something that is often overlooked, but something that is very important and really is intertwined with what I presented earlier and even what is happening now. Mental health in men, I think, is often overlooked because, as I said, men are supposed to be the pillars of society. They're supposed to be tough, right? But we don't know what is happening in the minds of our young men, especially when they are having issues with their genitals, especially in this time of the pandemic, where one of your brothers, maybe what kept him mentally intact was just being able to go on the balcony to peek over the backing screen, looking at his fellow brother having sex. All of those voyeurism. That is the livelihood. Maybe it's looking out on the quadrangle, trying to see where the pantry tree once was. All of those things that might be what kept his mental health intact, and him not having that now, being in isolation or being in quarantine, can definitely affect his mental health. And some of the most common and mental health issues include depression. And depression is often often goes unnoticed, right? It is very subtle and it creeps in um, very, very quietly, I should say. Um, Depression can manifest in many different ways. Usually, it's just loss of interest in things that you usually find fun. So, for example, if you're used to play football but you're not playing it as much, if you used to go out with your friend but you're not able to do that, sometimes there's a bit of sadness. It can even manifest as you not eating as much as you used to, with you even sleeping more than you're used to. So the signs and the symptoms of depression are very subtle. So in these times we have to be our brother's keeper, and we have to check up on each other and to ensure that they are mentally tackling this pandemic and the changes that have occurred due to this pandemic. I mean, bipolar disorder, I'm sure in every year group there is somebody on hall who possibly has bipolar disorder. This is usually easier to spot than depression. This person might be all over the place, very energetic, seem like they're at a goal. They're completely entrenched in whatever activity they're doing. Then all of a sudden you might see them stop. Then they might even get a episode of depression, and you might see that, but there's no order to what this person is doing. This person's all over the place. It is out there. And I think while living on campus, I've seen an individual who is known to have bipolar. Schizophrenia, it's out there. This is where you call people the madman, but it's actually schizophrenia. It's highly associated. All of these mental disorders are associated with drug use, so cannabis, alcohol, drinking. So if you see your brother who used to probably smoke once per day, now going 10 times per day, who didn't used to smoke, these are the subtle signs that you should look out for. So with that said, you know, unity is always strength, right? And I think that we as Chancellor Rights, we roll as a pack or a pride, right? And the relationships that you have formed within the halls of Chancellor extends beyond Chancellor. And I appreciated that when I graduated from Chancellor, that Chancellor is not just a physical aspect. Chancellor is the relationships that you have forged during your tenure on the hall. And if you go anywhere and you say that you're a chancellor, man, Bruce McDonald, he was one of my students when I was teaching, and just him and Brad saying that the chancellor, man, then automatically there is a difference. So the black and the gold goes far, goes beyond the confines of the liming bench. So thank you very much, guys. If you have any questions, I will be more than willing to answer them.
And we are ready and waiting for the questions in the comments for the doctor based on his presentation, based on his university experience, based on what he has been through post-UA. Just keep them coming as we wrap up tonight. Questions in the comments. Bipolar disaster. How do you do a self-analysis for bipolar disorder or any of the other mental illnesses? All right, so we have a question from Mr. Terry McCoy, Doc. How do you do a self-analysis to see if bipolar disorder or any of the other mental illnesses?
All right, Mr. McLean, thank you for that question. So to do a self-analysis, what you can find on the internet, they actually have mini questionnaires, and these are screening tools that are used to help even physicians to identify any person who might be suffering from a mental illness. So there are different screening tools. You have screening tools for depression, screening tools for bipolar disorder, and screening tools for schizophrenia. So you could easily search online and you could find one of those screening tools. And essentially what it entails is a list of questions or symptoms. For example, are you feeling down? If you answer yes, are you feeling that you're not enjoying activities which are usually found interesting? If you answer yes to say about 2 or 3 of those, then it will say that you are at risk or you might have depression. And what it will do is, for example, give you another screening tool with more symptoms or signs related to depression. And as I said, depression, all of these, depression itself ranges on a scale from mild to severe. And sometimes it does not necessarily need medication, but if you can identify what is causing you to be depressed and you address that, then that can prevent you from slipping deeper. So there are tools out there for which you can do your self-analysis. And after that, you can decide that, I would like to seek some medical care, because at some point, if it is very severe, you might need medication to give you a little boost. Sometimes people just need that boost to get back into their routine and get back to their normal mental functioning.
All right, thanks very much. I actually have a question of my own. Now, there is popular opinion among men in relation to getting tested for many of the popular STIs and STDs, especially HIV/AIDS, that if you don't know, it can hurt you. So I'd like to know what's your opinion on that commonly held sentiment, and what advice do you have to those who would hold that belief dear?
So See now, you're definitely a man. So it's not you. I mean, I think Jamaicans on our whole have this belief that what you don't know can't hurt you, but I would like to strongly disagree with that, disapprove, discourage that form of thinking because it can hurt you. And actually, I've had instances where I've said to my fellow brother and chancellor that, hey, let's go do a test. They're scared. They won't go. They literally run because they know that they've been living a promiscuous life. So they are very fearful of what the result may show. But I would say at least annually, if you know that you've been partaking in high risk behavior, you should get tested. This is not only for you, but for even your partner. And this is how it is actually spread, right? So you not knowing, you having unprotected sex with your, want to say right out girl, and she contracts the virus. So that is now like a public health problem. You're just spreading, and that person is a very dangerous person. The person who says that what you don't know can't hurt you. And to even go further, throughout my career, I've worked with persons who have HIV, and I've heard the stories. A lot of their partners don't know that they have HIV, and the lady will be telling the man to use a condom. The man said, no, he's not using any condom. To me, that is just outright carelessness. So, gentlemen, if you have never done an HIV test, your hearts might be jumping out of your chest when you're going to do that. But use the unity in strength. Speak to someone that you're comfortable with. Both of you guys could go and get that test done. I am seeing where Mr. Phil Mark Miller is asking, does rice and our rum really contribute to what is commonly known as beer belly? So beer belly, I think it is real. I think that at one point I was developing it, but I will not have that. Yes, rice is a carbohydrate. It has a lot of calories, right? And once there is a lot of calories, you will gain weight. More specifically, if you have not been doing what you usually do, as in your level of activity, you decrease. So what happens is that you're an active young man. You're demonstrating your prowess in sport. When you get to working, yeah, it's hard to incorporate your usual Chancellor Hall activities with work. You get a bit more laid back. You get more comfortable. It's now easier to go online with the man's. It's now easier for you to buy food, buy junk food you don't want to eat. So all of these do contribute to your beer belly. So I'd advise, if you're going to drink rum some more or you're going to eat a lot more rice, then ensure that your physical activity is on par with that. So Mr. White is asking what daily routine you can practice to ensure your physical fitness a couple of years down the line is at its best. Um, I would have to say that this is something that you would have to design, and there's no one way of doing it. And it's better if there's an activity that you like. For example, if you like swimming, or if the man's them usually just play ball. So ensure that at least 3 to 5 times for the week that you're doing that. I mean, I must admit that I have not been doing that. I feel that my fitness is at its worst now. I'm still trying to get back in there. So it'll be very based on your work schedule, based on your timing. Could you incorporate some physical activity. Whether you want to do push-ups in the morning, whether you want to go walking or jogging, cycling, find something that you like that will get your heart rate up for at least 30 minutes per day. You can do that 3 to 5 times for the week. So Mr. Cadell is asking, does smoking affect our abilities? So, Mr. Cadell, you say abilities. I don't know what abilities you're speaking about, if you have special abilities, but I will take the hint and I will assume that you're thinking about your performance with the opposite sex. So, it has been shown and it is known to affect your, and I quote, abilities. Reason being that smoking, there are over 20 what we call now, there are over 20 compounds in cigarette smoking that can affect the body, and this would be more specifically affecting the blood vessels. So what causes an erection is that you have your blood vessels and there's blood rushing into the penis. After a while, there's a what can I call it now, like a coating surrounding the penis. Once there's enough blood in your penis, that coating will get very, very tight, right? So if smoking does damage the blood vessels to your penis, then definitely this can affect your abilities, Mr. Green. Also, and I'm not going to say do not smoke. With everything, you do it in moderation. If you want to do a one for the week, I don't think that will cause damage. It's more accumulated over the years.
All right. Thank you very much for those answers. I'm not sure if there are any more forthcoming from the comments, but if there aren't, we can proceed to our sponsored question, which will, of course, lead to a giveaway for whoever is successful. And the question for tonight, this question is sponsored by the Portrait Place JA. So for the viewers in the comments, type in your answer and see if you can get lucky. Which sexually transmitted disease begins with an ulcer on the genitalia, which disappears after approximately 3 months and then causes sores and rashes right across the body? So for the viewers, which STI begins with an ulcer on the genitalia, which disappears and then leads to sores and rashes right across the body? Let's see your answers to win a sponsored giveaway from the Portrait Place JA. We're seeing gonorrhea. Not quite. We're seeing herpes. Not quite. And we have a winner, Mr. Daniel Collins, who typed in the correct answer of syphilis. Please leave your contact information with those in studio, whether via the YouTube page or via our Instagram pages, and we'll be in touch with you with the delivery of your prize. So, mans and mans and our viewers, it has been a very enthralling, dynamic, action-packed series, and we have, unfortunately, because they say all good things come to an end, reached the end. Now, first and foremost, we want to extend our deepest gratitude to our presenter for tonight, Mr. Marlon Reid, for sharing with us a wealth of information. I am sure everybody left here with an improved